Now we come to the cardiac cycle, or the chain of electrical events that occur during a heartbeat. The process of depolarization begins at 1, that is at SA node, passes to the atria, that's number 2, and then at 3 it passes across the AV node to the ventricles. In the ventricles it travels along the right and left bundle branches marked 4 and then through the Purkinje fibers to the ventricles. Now correlating the events to the ECG recording, the process of activation, that is depolarization, begins at the sinoatrial node or the SA node situated in the right atrium. Within 0.06 to 0.08 seconds, the atria get depolarized, which is recorded on the ECG as the P wave. The wave of depolarization has to reach the ventricles through the AV node, which delays the impulse by 0.1 second. During this time, there is no significant electrical activity and ECG records as the isoelectric PR segment. Now, as the impulse spreads throughout the ventricles within about 0.1 second, the septum gets depolarized first, then left and right ventricular walls almost simultaneously, but a little earlier on the left side. This activity is recorded as the QRS complex. Once the ventricles are totally depolarized, there is no electrical activity for a brief period, so the ECG returns to the isoelectric line and records the ST segment. Then the repolarization of the ventricles begins and is recorded as the T wave. The repolarization is much slower than the depolarization, and so the T wave is broader than the QRS complex, but it is in the same direction as the main wave of the QRS complex.
For more such stuff, do subscribe to Date with Medicine.